You've had blood tests before, but did anyone ever actually explain what those numbers mean? CBC, A1C, TSH, LDL? It looks like alphabet soup. Today we're breaking down basically every major blood test in plain English. By the end, you'll actually understand your own lab results. First, the basics. When a nurse draws your blood, it usually fills several small tubes. Each tube has a different colored cap because each test needs the blood handled differently. Some tubes spin in a centrifuge, separating the watery plasma from the cells. Others go straight into a machine that counts and analyzes the cells directly. From there, the tubes travel to a lab where machines and technicians take over. Some results come back within minutes, others take a few days. Let's start with the most common test of all, the complete blood count, or CBC. This single test measures the three main types of cells floating around in your blood. Red blood cells carry oxygen from your lungs out to every tissue in your body. Hemoglobin measures the oxygen-carrying protein packed inside each one of those red cells. That's a lot of letters already, and we're just getting started. Hematocrit shows what percentage of your total blood volume is actually red cells. MCV measures the average size of your red cells, which helps pinpoint the type of anemia. Sometimes a technician also looks at a blood smear directly under a microscope. Low numbers across these markers often point to anemia, which can cause fatigue and weakness. White blood cells are your immune system soldiers, constantly patrolling for infection. A CBC often breaks white cells down further, into types like neutrophils and lymphocytes. A high white cell count often just means your body is actively fighting something off. A reticulocyte count checks how many brand new red cells your bone marrow is producing. Platelets are small cell fragments that clump together to plug small cuts and stop bleeding. Low platelets can mean you bruise or bleed more easily than usual. Next up is the basic metabolic panel, often ordered right alongside the CBC. This panel includes glucose, which is simply the amount of sugar circulating in your blood. Eating affects this number a lot, which is why some tests require fasting first. It also checks electrolytes like sodium, potassium, and chloride. These minerals help control your heart rhythm, your muscles, and your fluid balance. BUN and creatinine are waste products that your kidneys are supposed to filter out of your blood. When these levels rise, it can be an early sign your kidneys aren't filtering as well. A CO2 measurement is usually included too, reflecting your body's acid-base balance. A separate test called a blood gas goes even deeper, checking oxygen and acid levels directly. Doctors sometimes calculate an anion gap from these numbers to spot hidden metabolic problems. While we're on minerals, let's quickly cover calcium, magnesium, and phosphate. Calcium supports your bones, but it also helps your nerves and muscles function properly. Magnesium helps regulate your heartbeat and keeps your muscles from cramping. Phosphate works closely with calcium and helps store energy inside your cells. Now let's talk cholesterol, measured by something called the lipid panel. This test estimates how much fatty buildup might be forming inside your arteries. LDL is often called bad cholesterol because it tends to stick to artery walls. HDL is the good cholesterol, helping clear excess cholesterol out of your bloodstream. Stick with me because the next few tests matter just as much. VLDL carries extra fat through your blood and is usually estimated rather than measured directly. Lipoprotein(a) is a genetic, inherited type of cholesterol some doctors check separately. Triglycerides measure fat from food that your body hasn't burned for energy yet. Doctors look at the balance between all these numbers, not just one in isolation. Total cholesterol combines all of this into one overall heart health snapshot. Let's keep moving through the panel, moving on to liver function tests, which check how well your liver is working. ALT and AST are enzymes that leak into your blood when liver cells get damaged. High levels here can suggest inflammation, infection, or strain on the liver. GGT is another liver enzyme, sometimes used to flag bile duct issues or heavy alcohol use. Ammonia is sometimes tested too, since a struggling liver can let it build up and affect the brain. Bilirubin is a yellow pigment, and too much of it can turn skin or eyes yellow. Albumin, a protein made by the liver, shows how well it's producing key proteins. Alkaline phosphatase rounds out the panel and can flag either liver or bone issues. Let's check the thyroid, that small butterfly-shaped gland in your neck. TSH is a signal sent from your brain, telling the thyroid how much hormone to make. High TSH often means an underactive thyroid, which can cause fatigue and weight gain. There's more to your blood than you'd think. Low TSH can mean an overactive thyroid, causing a racing heart or anxiety. T3 and T4 are the actual hormones the thyroid releases directly into your blood. Each of these tests tells a small piece of a bigger story. Thyroid antibody tests can reveal whether your own immune system is attacking the gland. Doctors sometimes test free T4 specifically, the portion actually available for your body to use. Together, they build a full picture of your health. Now, one of the most important tests for long-term health, the A1C. A 1C measures how much sugar has coated your red blood cells over about 3 months. Unlike a regular glucose test, it shows your average, not just today's snapshot. Doctors use it to both diagnose and monitor diabetes and prediabetes. An insulin test is sometimes added to see how hard the body is working to manage sugar. Homocysteine is an amino acid that can rise with B vitamin deficiencies and affect heart health. Coagulation tests check how well and how fast your blood is able to clot. PT, or prothrombin time, measures how many seconds it takes your blood to clot. INR is a standardized version of that same test, often used to monitor blood thinners. A few more important ones are coming right up. PTT checks a separate part of the clotting process inside your blood. D-dimer rises when a clot is forming or breaking down somewhere in the body. Heavy metal testing checks for things like lead or mercury that shouldn't be in your blood at all. Almost every system in your body shows up somewhere in this list. Next, 2 simple tests that can detect inflammation almost anywhere in the body. CRP, or C-reactive protein, rises quickly when there's inflammation or infection. ESR measures how fast red cells settle in a tube, which speeds up with inflammation. Neither test says exactly what's wrong, just that something is going on somewhere. A more sensitive version, HSCRP, is used specifically to estimate long-term heart disease risk. Let's look at vitamin tests, often checked when you feel constantly low on energy. Vitamin D is made from the sunlight hitting your skin, and it supports bones and immunity. Vitamin B12 supports your nerves and helps your body produce healthy red blood cells. Folate, or vitamin B9, works closely alongside B12 for many of the same reasons. B6 is sometimes added too, supporting nerve function and red blood cell formation. Ferritin reflects how much iron your body has stored away for later use. Low iron, or B12, is a classic, often overlooked cause of constant tiredness. A full iron panel digs deeper, checking exactly how iron moves and binds in your blood. Zinc levels can also be checked, since zinc supports healing and immune function. Fat-soluble vitamins A, E, and K can also be measured, though less commonly than vitamin D. Hormone panels check the chemical messengers that regulate mood, energy, and more. Cortisol is your main stress hormone, and its levels naturally shift throughout the day. Testosterone and estrogen are checked for reproductive health, energy, and mood concerns. Prolactin is another hormone sometimes tested, tied to milk production and menstrual cycles. Like thyroid hormone, testosterone can be measured as free or bound to a carrier protein. These hormones all interact with each other, so doctors often test several together. HCG is the hormone blood test look for to confirm an early pregnancy. Here's a fun one. The blood type test. Your blood type is determined by markers called antigens on your red blood cells. The plus or minus you see refers to the Rh factor, another marker on those same cells. Matching blood types correctly is absolutely critical before any transfusion or surgery. Blood can also reveal past or current infections through antibody and antigen tests. Antibody tests detect proteins your immune system made to fight off a specific germ. Antigen tests look for pieces of the germ itself, showing an infection happening right now. These panels are routinely used to screen for hepatitis, HIV, and other infections. A blood culture actually grows a sample over time to check for bacteria in the bloodstream. ANA, or anti-nuclear antibody, helps screen for autoimmune conditions where the body attacks itself. Let's wrap up the rarer, more specialized tests next. Allergy blood tests measure a specific antibody called IgE. High IgE levels toward a specific trigger suggest your body sees it as a threat. Rheumatoid factor is another antibody test, often used when joint pain suggests autoimmune arthritis. And then we'll bring it all together. Tumor markers are substances in the blood that can rise when certain cancers are present. PSA, for example, can rise with prostate conditions, including but not only cancer. These tests are clues, not diagnoses, and always need follow-up imaging or biopsies. Procalcitonin is a newer marker that rises specifically with serious bacterial infections. Uric acid is checked when joint pain raises suspicion of gout. Toxicology screens detect medications, drugs, or alcohol present in the bloodstream. Lactate levels can rise during intense exercise or certain medical emergencies. Some blood draws are even used for genetic testing, reading your DNA itself. So the next time you get a lab report, those letters won't look quite so scary. You now know roughly what your blood cells, organs, and hormones are telling you. Of course, always discuss your specific results with your own doctor, not a video. If this helped, subscribe for more topics explained simply one drop at a time.